Well, thank you so much for our teams putting this together. That is awesome. For everybody that's viewing this, hello everyone. My name is Nikki, and I am the Lead Nurse Navigator working with the Advica Health team. I am a registered nurse. I have been with the team for the last couple of years now, or approaching 2 years. And previous to that, I have worked in hospital throughout my nursing career and have worked in various areas that have really helped me create a platform to my career. And so whether it be from, palliative to emergency, intensive care, rehabilitation, all of these areas have added to my experience. And in each of those, there's a component of mental health because of every area of our bodies and of our care, there's going to be mental health. And so it's really been a top priority in my nursing experience. So now, I'm working with the Advica Health team, and it's really been such a great experience to be able to help provide our members and Canadians across the country here to be able to support them virtually through our programs and supporting mental health, which is going to be our focus today. Today, I'm going to be joined by Joy from Homewood Health, and I'm going to bring her in to tell us a little bit about herself. So Joy, over to you.
Hi, thanks, Nikki. My name is Joy Sereda. I'm a registered psychotherapist and registered social worker with my master's degree in psychology. I've been working in the mental health field for nearly 17 years, and my experience covers a wide range of client clinical concerns in a variety of different service environments, which include nonprofit, health authorities, and private practice. I've been working with Homewood Health for approximately 4 years now, and I am a clinical manager with their national first call care team.
Awesome. So happy to have you here with us today so that we can really dive into this great discussion. And today we're going to be going through the impacts of, the pandemic on our mental health. It's been such a huge year and a half now that we've really been going through this. So we want to discuss, burnout, support options through both Homewood Health as well as Advica Health, and the importance of self-care, and how we can best achieve this as individuals. So we will also touch upon some great resources for you watching to be able to access ongoing support, as well as if you're in perhaps a crisis situation and you're not sure where to go. We're going to provide who you should contact and who you're able to reach out to. Throughout this chat today, please keep in mind that it is never too early to take control of your mental health. For your physical and mental health, really, it's never too early. And we want you to know that there are services out there 24/7, 365 days a year, and we're going to be here to discuss some of that today and to support you. Perfect. So we're going to sort of jump right into what some of the impacts that we've noticed of mental health impacts from COVID-19 in our line of work today. Joy and I are kind of going to go through different areas. And as I mentioned, I'm the Lead Nurse Navigator that's working with the Advica Health team. And so what we're able to do is we're all virtual. So we're connecting with our members, whenever they're reaching out, whether it be for physical health needs or mental health. And so we've seen so much increase in that in the last year and a half for both physical and mental health needs. And what we're really seeing is that people's anxiety, stress, depression, elements of PTSD, these have all escalated just among, other physical health conditions have as well. People aren't necessarily taking care of themselves the way they once were before all of our isolation and before, everything was virtual and there was minimal physical contact. And so we want to just remind people that it's so important to not let this pandemic sort of take over our priorities of our health. We want to continue to take care of ourselves, both physically and mentally. And so that's going to be what we're going to have a good focus on today. Joy, have you noticed any sort of trends that you have found in the last year and a half specific to mental health?
Oh, absolutely. Since the start of the pandemic, there's a clear increase in people who are seeking support for their mental health and wellness. A lot of the struggles that people are coming forward with are in line with what's reported in mainstream media. So, stress management, anger issues, lots of anxiety concerns, depression and low mood, COVID fatigue, and burnout. Lots of people are also struggling with loneliness and isolation, which in itself exacerbates stress, anxiety, and depression, and really negatively impacts a person's ability to cope. In addition to that, we are also seeing a lot of increased alcohol and substance misuse, a lot of family conflict, relationship problems, and parenting difficulties. Of course, none of this is a surprise given the type of stress the pandemic has put on everyone. In addition to that, there's also been a marked increase in people needing more targeted support, particularly for traumatic stress issues and depression. At Homewood, we have a trauma care and depression care program, and both of those programs have seen a significant rise in the need for their specialized service over the last year.
Yeah, and I think that really just sort of brings in both the physical and mental health components and how they go hand in hand, right? If we're not taking care of our mental health, our physical health often suffers, whether that be with the increase in drug and alcohol intake, that has effects on our liver, on our internal organs, our heart. These are all things that we need to keep in mind and try and really sort of take control of and sort of anchor back and know that taking care of both our physical and mental health is so important, and it really does go hand in hand. So keeping up with our walks and our doctor's appointments, whether it's virtual or not, if something's come up and you feel that oh, I've got a physical ailment of some kind, I need to reach out for that. We want you to be doing the same for your mental health. You know what, I'm not feeling myself, I should be reaching out to my family doctor or a healthcare provider so that you're getting that care, and we're not sort of snowballing into a much more serious health concern and healthcare situation as we move forward. Because yes, we're all hoping that this pandemic is going to be ending soon, but to say, oh, I'm going to start back with my health when that's done, we don't have a specific timeline of when that is going to be. So I think that taking control today and really knowing, what, I'm going to start back with my physical and mental health, and I'm going to start taking control. I think that's going to be a huge thing for everyone across the world, really, to just kind of remember.
Absolutely.
So thanks for that, Joy. So now moving on to this employee burnout here, and just sort of burnout in general for people. It's not just employees. Everybody has different styles of job, whether you're maybe a healthcare worker, maybe you're working on the front lines in the grocery or pharmacy, firefighters, in the business world. There's tons of different areas that bring about lots of concerns, and mental health doesn't only affect one type of career or one type of person, it affects everybody. And so just sort of some things that I have noticed throughout sort of my nursing in the last, say, year and a half during this pandemic, there's three sort of areas that I've noticed. And one is where it's we've got young families, or maybe families with adolescents, or kids still living at home, kids living afar. There's a lot of sort of blurred lines and work-life balance concerns, and figuring out how to manage that stress. We're all primarily working from home right now, and I know it varies across the different provinces and whatnot, but for the most part, we've all gone through that. And it's really been a challenge to try and figure out, okay, when am I shutting off my computer, or when am I walking away? And okay, my children are walking in the office and I'm trying to get my work done. How do I not snap at them? How do I not figure out, okay, this is my time? Well, right now it's just so challenging for our members and trying to support them. So what would you say, Joy, is some just, advice and tips that you would give for, say, parents parents with maybe teenagers, young kids, or sometimes even grown adults that are still at home and everybody's working from home. How do you figure out how to sort of figure out those blurred lines and that work-life balance?
Very good question. I think we can all agree that lockdowns, stay-at-home orders, school closures have put unbelievable pressure on families. It's really difficult to juggle the demands of work and parenting at the best of times, far less in the middle of this pandemic when there may be literally no separation from the two. So finding and maintaining this work-life balance is really tricky. At the same time, failing to do so, it creates a stress that is cumulative, and that spills out into other areas of our lives. So finding those practical tools to help. Unfortunately, there's no simple a magic wand that fixes it all, but looking at some things that may seem really simple on the surface can actually be really effective. So one of the examples I have is actually from someone who they found that their office was suddenly now in their living room. They were having a really difficult time with separating work from non-work. They were distracted by Netflix during their work hours, and they were distracted by their work computer and email during their off work hours. And so what they did was they actually got a bed sheet, plain old bed sheet, and from Monday to Friday, 9 to 5, that bed sheet lived over top of the TV, separating them from the TV. And then once 5 o'clock hit, that bed sheet flipped over and went over top of the work computer. And that's where it stayed until the start of their next work day. Other little simple steps, like I think you referred to, is shutting your computer down. At the end of the day, shut your computer all the way off. Make it as difficult to quickly access those emails as you possibly can. Turning off notifications on your phone, especially work-related notifications, that's really, really helpful. Make it less accessible. Having realistic expectations of ourselves and of others is really important. We simply cannot hold ourselves to pre-pandemic standards because things are just not the same. We don't have access to the same supports. We don't have access to the same activities, outlets, or childcare that we did before. So with that, it's important to understand that just as much as adults are struggling with this pandemic, so are kids. We as adults, we have the ability to try and process, understand, and problem solve in a way that kids don't. So this has been a really scary time for them. And how they express those fears can come out in their behaviors, in their eating patterns, sleep schedules, temper tantrums, and the need for extra attention and reassurance. So remembering that some of these behaviors that you might be seeing in your children are actually their attempts to express their fear can really help reduce our frustration response, and then therefore also reduce our stress level. When it comes to finding a way to try to separate parenting and work, or try to make the two work together, I think communicating with our children so they have information, but of course in a age appropriate manner, helping them feel in the loop, helping them understand when it comes time to, listen, I need this time to do this one thing. We want to bridge to the next time that we can connect with them. So, I'm going to work on this and I would like you to work on this. And then after we're done, we'll have a snack together. So things like that, bridging to the next time, that can really help reduce their anxiety in the moment and help reduce their kind of attention seeking behaviors.
Yeah, that's awesome. And I think that's something really for us all as individual as well as parents to remember. It's not just us as adults that are going through this. It's your teenagers, it's your kids. Gosh, it's gonna be your these young babies who are born during a pandemic. They're gonna have their own challenges, right? Where they've never been encountered by lots of, strangers and things like that, because we have been so isolated in some sense of not having that interaction. So I think it's just remembering that we're all going through our own experience with this pandemic. So remembering that our kids are also going through this, and our siblings, our spouses, whatever it may be. I think that's a really good point to make there. So then that kind of leads me into, yes, these families all have this support in-house. Everybody living together, has that physical contact and sort of ongoing relationship and conversation with one another. But then it brings me to the point where, how about those that are living alone? The ones that, they've finally maybe have gone out into the work world and they're living in their own apartment. And this is something that we've seen, we're changing generations right now, and tons of people are starting their careers, and there's a lot of sort of different age gaps that, maybe you're single in your 40s, maybe you're single in your 20s, maybe your spouse is away, there's lots of different things. But what would you say for those that are experiencing such loneliness right now, and maybe they're just nervous or uncomfortable or not wanting to be a burden to their peers, their families, with dumping sort of their mental health? And I say dumping, but it's not dumping, it's just bringing that conversation to the light, but they're nervous to do that, or they're hesitant to do that because they're aware that everybody is going through this pandemic together, and they know that everybody has their own concerns right now. So what would you say are some tips for those that are living alone, or are simply just feeling that loneliness, whether they're surrounded by people or not?
Right. And I think the first thing is I want to acknowledge that the emotion of loneliness, the experience of loneliness, it's an incredibly painful and powerful emotion, right? So I think it doesn't get the attention or credit that it deserves.
Mhm.
And so for many people, they went from working in a busy office environment to suddenly on their own. And that in itself is stressful to make such a huge change and transition. And also, I think back in March 2020, no one expected this to still be going on, after this amount of time. So we are seeing a lot of people really struggling with the isolation and the loneliness. In general, when we're struggling, it is important to connect with those in our social support network. However, with COVID and just the nature of how it's impacting everyone, we're seeing a lot of people who are really struggling with making and maintaining those connections. So I hear a lot of anxiety, and a lot of social anxiety in particular,
Mhm.
because we're all at home. None of us are going anywhere. We all struggle to find things to talk about. We're tired of talking about COVID, and yet because it impacts so much of our day-to-day life, we're actually not left having much else to discuss or anything new to talk about. And so this can lead to people feeling really uncomfortable with socializing. They have this skewed belief that they just should be able to have the same kind of conversations and interactions before that we did before the pandemic. Um, the good news is that a lot of people are feeling this way. A lot of people are feeling socially awkward. We're all in the same boat. So it's recognizing that anxiety and discomfort is normal, and connecting with others anyways is a really important step for us to take. So how we get connected requires us to get creative. So I encourage people to try connecting with others in ways that you may not have tried pre-pandemic. Joining an online group, or joining an enjoyable, relaxing, or interesting hobby class online. Using social media with caution. We want to try to use it in a way that benefits us instead of in a way that increases stress and potential conflict. So also many, like you mentioned, they're worried about discussing their own stresses and struggles with friends and family members. But thankfully, there are lots of services out there to support people with their mental health and wellness. So I'm encouraging people to get connected to those supports, and not to let these struggles or concerns about talking about their struggles impact or prevent them from connecting with the people in their lives.
Yeah, that's awesome. And I think, you really pointed out it's getting creative. It's figuring out new ways. Yes, you may have lived alone for the last 5 years, but you've never experienced this loneliness because you went out and did activities, you went to work, you went and you played on a sports team, or you did some sort of activity, every week or every couple of weeks, trying to figure out ways to bring that in. And really, there's so many different online platforms that are available, and whether it be an activity, like you said, start doing yoga, maybe do it with all your friends on, set up a big team Zoom and do a workout activity or something like that together, maybe a workout group you used to do in person. See if you can gather a couple of those friends to do that, like through just another platform, right? So you're absolutely right. It's just about kind of getting creative and figuring out how we can bring that sort of joy back into different activities in our life from day to day. So that's great. Another big thing that we've seen and that I've spoken with a lot of members and just friends and family in general is just feeling support from your employer and managers. And sometimes, there can be tough conversations where it's I'm just not feeling like my employer is understanding what I'm going through with my mental health, and I'm feeling stressed, and there's so many new roles that I'm sort of taking on, and you've got all of this. And I think where it's sort of becoming tough is our employers and managers and colleagues, for one, everyone's going through the pandemic, right? We have to kind of keep in mind that it's not just us as the employee that is going through the pandemic. It is the employer as well, and everybody who's helping run those businesses. And so I think just keeping that in mind is something that's really important. But I am trying, or I am hearing, I should say, a lot of people who are concerned about their mental health, and they don't know how to really approach employers or maybe how to feel more supported. So Joy, what would you say would be a good sort of way to tackle that in terms of being an employee or just feeling like you're not being heard? How would you say that would be a good stepping stone?
Yeah, it's a great question. I think the next slide that we're going to be talking about, it focuses on the strategies for leaders in the workplace. And I think it is important to acknowledge the difficult position that many managers and supervisors are in. And it can be really helpful as an employee to keep that in mind as well. The nature of how work has changed over the last 14 months really kind of primes us for more anxiety in regards to our position, our role, how we're judged at work. So keeping in mind that our managers and supervisors are also coping with this and also struggling with this can help depersonalize some of the anxious assumptions we may make, right? So our managers and supervisors, they have had to rapidly learn a whole new way of providing leadership to their staff. It might be having to suddenly work with a smaller team because unfortunately there's been layoffs. It might be having to change suddenly from in-person to remote, or working within all of these COVID precautions and protocols and restrictions. So managers are also seeing their employees struggle with the stress of the pandemic while also finding themselves impacted with the same stress. They can find themselves caught in this really uncomfortable place of trying to support an employee's personal struggles while trying to maintain the needs of their organization, while also trying to manage and maintain their own mental wellness. So as employees, recognizing that this is where your supervisor or manager may be in is going to be the first step in perhaps reducing some anxiety, and at the same time, giving you a different perspective of how you may want to approach the conversation. I'm a firm believer that communication is key. And so if we keep in mind that our managers, our supervisors, our directors, business owners, they're also human beings who are also experiencing a pandemic, we can, that can impact how we decide we want to approach them, communicate with them, and let them know when we're struggling and let them know what we need.
Yeah, absolutely. And I think just, from an employee perspective, just remembering that you have the ability to reach out to, say, your HR department to find out, what are my extended health benefits? What do I have access to? And, some benefits plans, you may have a good chunk of money to put towards, your maybe if you're looking to speak with a therapist, psychologist, whatever it might be, you're going to have that potentially as part of your extended benefits, but you're also going to have things for your physical health potentially as well, like massage therapy, physiotherapy, maybe acupuncture, things like that. So depending on what your extended health benefits are, you might have some things that are not only going to sort of provide and support your mental health, but also physical health, where it comes back to really being hand in hand and making sure we're taking care of both. Things like EAPs, and different programs that you may have through your employer, a great thing to be able to ask. And then for those who have Advica through your employer as well, reaching out to our team and just having a refresher, reaching out to your HR and say, you know what, you don't have to get into the issues and the nitty gritty of what's going on with your mental health, but just saying, hey, you know what are my possibilities and what are my access points for my mental health, and can you provide those for me? So that's just something to keep in mind when communicating with your employer and your sort of corporation that you may be in. So the next thing, Joy, it really leads into these leadership strategies that we were talking here. And I just want to maybe have you go through those a little bit further and explore a little bit more about these strategies, because I think that they can not only be used as on the employee level, but also as individuals, and sort of going through that and bringing this sort of leadership strategy back into the home, if that's possible. And so maybe if you want to just kind of elaborate on these leadership strategies a little bit more, that would be great.
Sure, absolutely. So the first one is modeling health promoting behaviors, right? So kind of practice what you preach, which is a lot easier said than done. But this includes taking your breaks, encouraging staff to use their vacation time, and making sure that you use your vacation time as well. Trying to leave work on time, reminding your staff that they are expected to as well. So kind of reinforcing that work-life balance. Try to avoid checking and responding to emails after hours. And yes, many feel that they need to do that in order to keep up with the work demands or even get ahead of things. But when we do this, the message that some of our staff will take from that is that they're expected to be working all hours as well. And we really want to avoid sending that message. I would also suggest checking in on the work environment, not only your staff's, but yours as well. So working at the dining room table for this long is probably going to lead to some aches and pains, which can add to stress. It impacts our quality of sleep, and so on and so forth. So being physically comfortable goes a long way in helping our mental wellness. And so they may need ergonomic assessment, and you might as well. So I think that's important, checking on things that we probably wouldn't have thought of or haven't been thinking of over the last year and a bit.
For sure. I mean, I know that I've gotten my chair, whether it's bringing your chair from your workplace that you're usually at, bring that home to try and make that little adjustment. Or, if you have the ability to order, say, a sit to stand desk or something like that. I know that I'm somebody who suffers from chronic pain. So that was important to me. Have a good chair and have a good support. In turn, you sleep better. So that's exactly right. Just it's these things that we don't necessarily think of. Oh, I'm just working from home. But this has been a long-term sort of go now, right? It's not just been, oh, I can work from home a day here and there. It's ongoing. So that's awesome. Sorry, I'll let you get back to it there.
Oh, no. It's a really good point. Because when we think about it, how can we realistically expect ourselves to be able to focus and be productive? That's a word I hear a lot. When we're in physical pain and we're not sleeping, right? And so the problem is we're in physical pain, we're not sleeping well, we're struggling to focus. And then so we may not be as productive or meet our own expectations. And then that leads to self-criticism, which leads to, more stress and more pressure. So, it's all connected, and it's really important to make sure we're addressing all these different aspects of our overall wellness. So, which also includes self-care. And as a supervisor, a manager, and even a parent in the home, sharing self-care ideas with your team, right? It helps to validate and normalize our need for mental wellness. So no one's expecting you to come up with a perfect self-care plan, but even letting your staff know that you're taking a break to go for a walk around the block, or sharing non-work related funny videos for a bit of a laugh break. or creating like healthy workplace challenges. For example, myself and my team, we're doing a 30-day music challenge right now. I've heard of others doing like a push-up challenge for 30 days, those sorts of things. So we want to make sure that work isn't all about work. If you think back to when we all worked in the office, we weren't head down going full tilt 100% of the day. There were chats in the lunchroom, stopping by a coworker's desk or an office. There were breaks and sometimes perhaps a run to the coffee shop or everyone going out for lunch. So just because we're not physically together in an office does not mean we have to remove the social aspect from work. And in fact, we really need to put even more effort into maintaining that aspect now, right?
Yeah.
Something else that I think is important for leaders to do is to take time to check in with your employees individually, just for the purpose of seeing how they are doing, right? Not necessarily about how work is going, but how are they doing? Meetings don't need to be start to finish all about work. Create a little bit of time for chit chat, right? For yourself and your employees to just kind of connect as people instead of colleagues. Um, Asking your employees what they need is important. They may not know what they need. This is a unique situation that none of us have ever been in before, but simply just asking them like, hey, is there anything that you think you need? Is there anything you think that we can do to kind of help get through this? Just asking helps your employee feel understood and helps them feel supported.
Yeah,
Now with
bringing that personal sort of
Yep,
conversation back into it, right? We're still people. We're not just
exactly.
robot employees. We're just because we're behind a desk now and behind a computer screen and behind the phone, it doesn't mean we're still not a person. We still need to chat and laugh and have those check-ins. Yesterday, I shared with my team, I sent our entire team a picture because my nephew decided to cut his hair in the mirror. So that was our afternoon laugh where he just decides at 5 years old to take a big chunk of hair off. Well, you know what, this is a laugh that we all sort of needed, and then again it just expands a little bit more into just normal conversation. Oh yeah, my kid's done this and my kid's done that. So it really just brings that personal sort of touch and connection back, which is so important as you're going through here. So that's awesome to point out there, Joy. Thanks.
Um, at the same time, I think it's really important that managers, supervisors, not get pulled into a counselor role in their role as being a supervisor or a manager. If an employee comes to you to talk about their mental health or emotional struggles, it's a wonderful indicator that you have created an environment where they feel safe to do so. And it really speaks to what a fantastic job you're doing as a leader. However, being a counselor, being a therapist is outside of your role, right? You already have a full-time job to do. This is not the time to take on another one. So the focus needs to shift to being understanding, being accepting, and focusing on the needs that your employee has and getting them connected to the right services to address those needs. By doing that, helping them get connected, you can continue to be their manager. You also get to conserve a whole bunch of your own energy by not getting pulled into that counselor therapist role. So reminding your employee, like you said, Nikki, of the EFAP program, right? But
Yeah.
making sure that the number is readily available to them. They don't have to come and ask you for it. It's
Yeah.
in a place that's easily accessible and they all know where it is. Encouraging them to check their extended healthcare coverage. If you happen to come across a website or a community resource that may be helpful, openly share it to everyone. And also don't hesitate to use any of these resources for yourself either, right?
Right.
So being clear about expectations and checking them, right? So we want to keep expectations realistic. We also want to watch for when someone is really struggling to meet those expectations. Do they need some extra support? Do they need some time? And then the big question is, are you struggling to meet expectations? Do you need some extra support? And do you need some time? Often leaders, managers who are really, really dedicated and invested in their role, they sometimes lose sight of themselves. And we really want to make sure that we keep checking in on ourselves just as much as we're checking in on our employees. I encourage managers and supervisors and leaders to consistently celebrate successes with their employees. So much negativity in the world these days. When we have a positive success or something like that happen in the workplace, make a point of bringing it forward. Make a point of even just letting your employees know that they're doing a good job. Working remotely leads to isolation and can increase anxiety. Not hearing anything from your manager, even though it may not be an indicator of anything wrong, it can stir up a lot of insecurity and anxiety about their job performance. So just taking a moment to say thanks for their work and for their dedication, it can really go a long way.
Absolutely. And I think, you touched on so many great points there. It's remembering that your role as a manager, you are still there to do your role. You're not there to be the counselor. That's what we have these programs in place for your employees. And you know what? You made such a good point that yes, if they're coming to you, you've done a great job in showing that you are empathetic and you can understand people. As human beings as well as employees. And I think it's so important. And sometimes, management and supervisors, business owners, they also take on their employees' struggles. So for them to remember, you know what, I need to take care of myself as well. So for them to be able to tap into these resources as well is something that's going to be so important, and really just keeping that in mind. And I loved your comment on sharing successes. So whether it be, you send an email, or you say maybe you have a team social. Yes, we're all on Zoom and Google and all these different things, but maybe make it a social where you don't really, necessarily have to talk what's happening in the day, but take time to celebrate the wins, whether it be something big or small. A win is a win right now. And so that's awesome. I think it's very important. And even, just colleagues, it doesn't have to be a manager that is praising someone or celebrating somebody. If you find your, coworker that's in a similar role to you or above you, maybe your supervisor needs to hear, you know what, you've been doing an awesome job. Thank you so much. I think we're crushing this. We're doing great. That's going to really help the morale overall for you, for your team. And it actually feels good to give someone a compliment and to celebrate them. It actually, or I find that for myself anyways, when I'm praising somebody and telling somebody, yeah, you know what, you've done an awesome job, feels good for me too, because I know that that's making a difference in somebody else's life. And so I think that that's something to remember. It doesn't always have to come from your manager down. It can go from you up. You know what, you're doing a great job. Thanks so much for the way you've been managing this or handling this situation. So I think those are some really good leadership strategies that we can sort of use across the board in different areas. So that's awesome. Thanks, Joy.
No problem.
So now moving forward to sort of some professional support options that are available. And there are so many that really are available, not only just to Canadians sort of across the board, but by province, there's tons of different options. So I want to dive into a little bit about Homewood offerings, because I know that the Homewood platform has so many for inpatient, outpatient, and all sorts of varieties of mental health. So Joy, what would you say are, why don't you tell us a little bit about Homewood and what you would say some of your key programs are that you feel are beneficial right now?
Homewood has so many programs and so many services. I don't know if I could do it justice in just a short period of time, but because Homewood has evolved over, I think it's nearly 140 years. They've been around. It's the only organization that offers a complete continuum of mental health and wellness services. So it's designed to support complex health and wellness needs, right down to day-to-day life stresses of individuals and employers. So Homewood is Canada's leader in mental health and addiction services. We provide a continuum of stay at work, return to work, and treatment services through a team of over 4,500, I believe, staff and clinical professionals. So
Wow.
we have a complete suite of services. It includes organizational wellness, employee and family assistance programs. There's different assessments, psychological assessments, substance use assessments, return to work, fit to work assessments, a multitude of different assessments. There's inpatient and outpatient treatments, recovery management, return to work, and family support services. So, and they're all customized to meet the needs of the individuals and the organizations. There is a very comprehensive list and a lot more information that's available on Homewood's website at homewoodhealth.com. I work for, like I mentioned, the National First Call Care Team. We are a component of Homewood. We are a large team, and what we do is we provide basically immediate support when someone calls in, and we will touch on this a little bit later, but when someone calls in and wants to speak to someone and get some support right away, they can be transferred and connect to our team, and our team is a group of clinicians. They're all mental health clinicians and professionals, and they provide immediate support services over the phone 24/7.
That's fantastic. And, as Advica, we are so proud to have a partnership with you guys. The Homewood team is doing a phenomenal job at, helping Canadians through specifically even just this pandemic, right? I know you guys have been doing amazing work for the last, I think, 140 years, you said, but, I'm sure that it has just been amplified in this last year and a half or so. And so thank you and your team for doing that, because I think that it's really been so beneficial knowing that there is that network of Homewood and how you guys can really support Canadians, whether it be on an individual or employee or organizational basis. So that's awesome. Now, flipping over to sort of the Advica Health services. If you are an Advica Health member, there's various support options that you might have. We have other partners involved. We have a mental health navigator option. And so that's where their program aims to connect with individuals to assist with their mental health that best suits their needs. And so it's a very unique experience in that there are two different options. It's not for sort of ongoing therapies and treatments. This is more where you can select from one or two options. They're not mutually exclusive though. So maybe you just need help finding a therapist and they do that through discussing your needs. And a member advocate can then locate options in your geographic area, whether you need online support or in person if available, and how you're going to access that. Do you have sort of extended health insurance? Is this going to be out of pocket, government funded, all different sort of things like that? And so finding those resources. Then they're also able to assist with psychological and psychiatric assessments. And so the way that they do that is we can, if you are an Advica member and you're reaching out, we would have conversations and we could put you in touch with a team to then have further assessments with a psychologist and psychiatrist if it is needed. And so we can explore that with you. So reaching out to the navigation team will be able to help support you in that manner. We also have nurse practitioner services that are available that they can provide that sort of high level mental health support. They can look at modifiable risk factors to help reduce the risks of mental health, and then finding different complications from disease. Maybe they're going to provide some basic screening, doing some assessments, or bridging and titrating medications. Maybe it would be a benefit to you to have some baseline blood work done to see where your levels are at maybe. And so reaching out to the nurse practitioner team that's part of Advica is also going to be something that you have access to. So really, between our partnership with Homewood and some of our other partners, it's just going to be so great to be able to support our members and fellow Canadians that are needing it at this time. So that's great. Thanks so much for diving into Homewood a little bit deeper there for us, Joy.
No problem.
So that brings me to our sort of next key thing here is supporting your well-being. So amidst all of the current challenges, what would you say are 3 key areas to protect your mental health and your well-being? If you can briefly touch on those, that'd be great.
Sure. So the 3 key areas they're pretty broad. So I follow the biopsychosocial approach to wellness. And what that means is 3 key components, 3 areas of our life. So the first bio is biological, right? So making healthy food choices, sleep. I can't even begin to stress to you how important sleep is. Taking our medications properly, trying to get some exercise, taking care of our physical health. So that's the biology piece. The psychological piece is watching how we're interpreting things and judging ourselves and the world around us. How are we reacting to uncomfortable thoughts and emotions? So taking care of our psychological health. And then social is also means environment, right? So in maintaining the space around us, the physical space around us, and also paying attention to and taking care of our social environment, staying connected to others. So those are the 3. They're very broad and they cover our entire lives really, but those are the three main keys, I guess, to our overall health and wellness. So basically what all this means is self-care. Right? And I know it's a term that gets thrown around a lot. It gets used a lot. And the reason why it gets brought up a lot is because it is important. So self-care refers to the activities and practices that we can engage in on a regular basis to maintain and enhance our health and well-being, and at the same time decrease our levels of stress. So we will discuss a few today, and just be aware that the ones that we touch on and talk about, it's not an exhaustive list. What works for one person will not work for someone else. The trick is, finding what works for you. And if you feel you can't find something that works, it just means you need to keep exploring and being as creative as possible.
That's awesome. So that kind of leads into foundations of self-care. And you've touched on this already and the importance of self-care. So why don't we just go through, what you feel are the key areas of self-care?
So the first that's listed here is the practice healthy thinking, right? The most important component of that is self-compassion, being kind to yourself. Give yourself permission to feel lost, worried, stressed. Now is not the time to be hard on yourself. It's not the time to be adding pressure to yourself. I hear from people all the time that, well, I've got to kick myself in the butt to get this done. Now's not the time for that. We do know that self-compassion usually results in, not only much more comfortable outcomes, but longer term positive outcomes than self-coercion. Mindfulness is another important component of healthy thinking. Practicing mindfulness helps us appreciate the small joys in life and helps us cope with negative thoughts by mitigating our negative experiences and responses to stress. So mindfulness can be something that just happens in a moment. It doesn't necessarily need to be, an hour of meditation. The key to having mindfulness be a stress reducer is to fit it into your life in a way that doesn't add more stress. And then the last component of the healthy thinking is gratitude, the quality of being thankful, readiness to show appreciation for and to return kindness. Now, it's important to acknowledge that this can be very difficult to do when we're in a rough place, and that's okay. That's normal. Trying to take a pause and take a step back so you can notice and focus on aspects that you are grateful for. Those aspects may be really difficult to see sometimes, but they are there.
Yeah, absolutely. So then that kind of leads into building a strong support network. And, social support is a healthy, adaptive way to manage stressful events and to hear outsiders' perspective. Connecting with others and trying to figure out, okay, are you feeling this way? Am I feeling this way? Maybe you've got things in common. And as we've kind of been touching on, everybody's going through something right now. So checking in with your friends, family, neighbors, coworkers regularly is so important. Even if it's just a, hey, how are you? I know you had a rough week last week. How are you coping today? Or how are you feeling? Are things better? Are things worse? Is there anything I can do to support you? And so I think that's going to be super important. Using technology to stay in touch. And I know, not necessarily using social media all the time, because there is so many, highs and lows of social media. I think just remembering to keep it as a positive. Don't go on social media to make comparisons of yourself. Oh, look at this individual. They're doing so great. They're managing, the pandemic so wonderfully. They're in the best shape of their life. They're doing this. That's okay. That's their experience. That doesn't have to be yours. So just remembering that, FaceTime even, whether you do a friends hangout Zoom meeting on a Friday night or Saturday night, heck, do it on Wednesday, midweek check-in with your friends. That's a great way to sort of just building that support network. Something to look forward to also. It's something to know, okay, you know what, I'm connecting with all my friends Wednesday. We can just let it all out and see how things are. And just remembering that support can come in many different forms. Emotional support and practical help, hey, do you need help around the yard, things like that. And that's outdoor activities that we can often do, right? And different things like that. Or just knowing that sharing points of view, sharing information. Yes, you know what, I get things, different resources that are sent to me about mental health, as well as, things about vaccines and all sorts of stuff. And I share that with my friends and my family. I don't keep it for myself. And so, I encourage others to do the same, building that network, letting people know, okay, you know what, we've got this in our area, just so if you need it, heads up, you've got access to that. So just keeping in touch with your network and your supports is going to be so important. And the next thing I would say would be nurturing your body. And I think this, again, just really comes back to that physical and mental health connection, and things that I've seen, and I'm sure things that you've seen, Joy, just knowing, that they do go hand in hand. Routine regulation and physical activity, both focusing on your sleep and healthy eating, that's going to help you do your best every day. If you're having a crummy sleep, you're not going to do your absolute best in your workplace or with your kids or whatever it might be. So making sure that you're doing all of this. Routine regulation also helps to reduce anxiety, making sure that you have that. Anxiety can interfere with our normal routines, sleep, eating, things like that. So it's important to develop and follow regular routines for our basic life activities, to sort of maintain that and know, okay, you know what, I've got this going on in my day, and I've got this, and something to look forward to throughout the week. And I find that structure is also really helpful with children as well, and keeping them sort of in a routine. Yes, it's COVID, and yes, we're living in a virtual world primarily right now, but that doesn't mean that your kids just shouldn't have any sort of structure, and it doesn't mean you shouldn't have any structure. So just remember, taking care of our physical and emotional health is going to be so beneficial for both our minds and bodies. Making sure that we're releasing those endorphins through physical activity. It's going to help our minds. It's going to help reduce the stress, the anxiety. Maybe you have a little bit of anxiety about getting into a physical activity or a workout routine. You can start it at home. Start by walking around the block. Start by taking the stairs in your home or apartment building, whatever it might be. So there's just little bits that we need to remember to aid in our physical and mental health, and really making them go hand in hand. So we need to bring those together to try and get an overall better health for us. Any points you want to make on that, Joy, for either our network or nurturing our body?
Well, I think it's important to acknowledge that a lot of the tools and techniques that we would normally be engaging with to accomplish these things and address these things, it's just not currently accessible. It doesn't
Hmm.
mean we don't need to reinvent the wheel. We just need to learn to be a little creative and kind of adapt or build on something that perhaps has worked in the past. And so asking ourselves the question, what has worked in the past? And can we adjust it so that you can use at least a little bit of it today? So an example I can give is with trying to incorporate some of that mindfulness into our day without trying to adopt a meditation practice and make time for that. uh, when you're in the shower, right? Usually when we're in the shower, our mind is in a million different directions. And so one of the things I encourage people to do is before you turn off that water, just pause for a moment and just allow yourself to be present in that shower, right? It's when we think about it, usually when we're in the shower, the soaps and shampoos, it smells nice. It's nice and warm. There's the white noise of the water falling. So just standing there, giving yourself even 30 seconds just to stand there and let all of your attention and focus go into, how nice the warm water feels as it's like hitting the back of your head, right? Or the smells that are there, or just the sound of the water trickling. So we don't need to be adopting massive, massive changes and new practices. We can take what we're already doing and adjust it just a little bit to help us meet all these needs and take care of ourselves.
That's awesome. I love that example, and definitely something I'll bring into my own sort of day to day. Enjoy those last moments in the shower and really bring that back. So that's great. Thanks, Joy. And
So,
so now we can. Oh, go
oh no, I
ahead.
was going to say, I can tackle this one a little bit, supporting ourselves. So what we want to do is just like how I said before, it's not about reinventing the wheel. It's about figuring out, asking ourselves what's worked, what hasn't worked in the past. One of the things we need to do is we need to kind of check in with how we're doing. How can we discover a new, a new self-care technique if we don't really know how we're doing moment by moment? So, reminding yourself to check in at several points throughout the day with how you're doing physically. Is my body tensed? You'll be amazed how often your shoulders are tense and you don't even recognize it. You don't realize it until you pause and just do a body scan, right? Are you feeling relaxed? Are you feeling tired? Mentally, is your mind racing? Are your thoughts calm? Do you feel focused? Are you having difficulty concentrating? And emotionally, what emotion is there? Are you feeling anxious? Are you feeling calm? Are you feeling uncertain, worried, grateful? And socially, how are you feeling socially? Are you feeling connected or are you feeling isolated and lonely? And then also checking in on what you need. This will change as time goes along. So keep listening and changing and responding to your needs as we go. So at the beginning of a crisis, we often seek comfort, security, and less stimulation. We kind of cocoon. But as time goes along, this can change. So we may have gone from at the beginning of all this really kind of needing to avoid, distract, hide under a blanket, and sleep more, to now we may be craving more interaction, more learning, setting more goals. We may also be experiencing both of those at the same time, which is very uncomfortable because they're conflicting. But this is all normal. So checking in with yourself, okay, so what do I need? What's going to work for me today? And then of course it goes back to being creative. And being creative means also staying adaptable to your needs, being flexible, right? Look at a resilience checklist, consider what you already have to draw on to cope with today, be it humor, acceptance, getting out in nature, meditation, gratitude, changing our self-talk so it's more on the positive side. And then considering what new tools may be helpful for you tomorrow or in the weeks to come. Um, Doing a daily stress check-in, scale of 1 to 10 right now, where are you at, right? Often the more stressed we are, the less likely we are to notice it unless we pause and check in with ourselves. And so based on all those check-ins, it's important to seek out professional help if you need it. So we're all experiencing events outside of regular human day-to-day experience, and you shouldn't be expected to tackle it all alone, right?
Yeah, absolutely. And, I think it really brings up the point that we shouldn't be waiting to tackle these things. Like, be proactive about it. Don't wait till you're in sort of a feeling of a point of no return. Be proactive about it when you start feeling off, when you're needing that little bit of support. Reach out and let's get proactive about really taking care of our health, both physically and mentally.
Absolutely. We don't wait until our house is fully engulfed in flame to call the fire department. We call them when we smell smoke.
Exactly,
Same works for us.
exactly, exactly. Which then brings into our wonderful service that you offer here at Homewood, which is the Wellness Together. So I'm going to let you speak to that a little bit more here, Joy.
Sure. So Wellness Together Canada, Homewood was a principal partner to deliver Wellness Together on behalf of the federal government. Wellness Together Canada is a online free resource, and it's available to all Canadians in support of their mental health and well-being throughout this pandemic. And it really is making an impact to the lives of Canadians across the country. The number of unique visits to the site recently passed 1.5 million, and I think it's well over 3 million page views, which also tells you how needed these resources are. We have delivered thousands of counseling hours to people all across the country, and Homewood Health hired approximately 100 additional people in the height of COVID-19 to specifically support this program. So Wellness Together Canada offers free live counseling through Homewood Health. It's 24 hours a day, as I previously mentioned. If you want to speak to somebody right away, you just need to call the number that's there, the 1-866-585-0445 number, or you can visit the website, thewellnesstogether.ca, for mental health support. And that website, I can say, has a ton of resources where an individual can register, or not. There's lots of resources available without registering, but you can access several different kinds of supports. It's fantastic.
That's awesome, Joy. Thank you so much. And, I know that I've sent so many members to the Wellness Together Canada sort of website and shown the support, friends, family, not just as a nurse, but as a friend as well. I know that people are really using this. But as an Advica member, if you're ever reaching out to the navigation team, you're concerned about your mental health, and you're looking to sort of get ahead, we can put you in touch with the Wellness Together Canada support team, and we can connect you with them to guide you through these situations and really get you connected with the resources that you need and the support that you need. So that's awesome, Joy. A really great program that all Canadians have access to. So that's wonderful.
Thanks.
Additionally, I do want to just point out that sometimes we're in a crisis situation where maybe our physical or mental health has just gotten ahead of us, and we're concerned that our behaviors are going to potentially be harmful to ourselves. So I want everybody to know that if you are in any sort of mental health crisis and you need immediate support and guidance for your health, please do not hesitate to reach out to any one of the crisis lines in your area. There is access, through Canada. It's going to bring you right to the provincial crisis lines, and you're going to be able to be connected with them 24/7, 365 days a year. So whether you remember to reach out to the Homewood team or through one of these crisis numbers, you're going to have that access to somebody 24/7, 365 days a year. And please remember, if you are unsure of who to call, but you are in a situation that your feelings, emotions, behaviors could possibly put yourself or others at risk, please don't hesitate to make that call, whether it be to 911 or one of your crisis lines, because we are here to support you and maintain your safety. So leading into our sort of final wrap up here, meaning our contact details. If you're looking to reach out to the Homewood team, the Homewood Health team directly, their website is here, homewoodhealth.com. You can also reach out to Nibith from their team, who would be able to explore some of the different options that are available for you if you're looking specific into Homewood. You can also reach out to the Advica Health team, whether you are a Advica Health member or you're looking to become part of our program, then you know what, you can reach out to Astasani and she'll be able to connect with you and explore some of the services that are available. So I just want to thank everyone for joining us today and allowing us to reflect and converse on some of the areas of mental health that we encourage you to focus on. And thank you, Joy, for providing us with your expertise and incredible insight and knowledge into how we can best support ourselves and others throughout these challenging times.
Thanks for having me.
Yes, it's been great. So again, you know, everyone, please never hesitate to reach out to a healthcare provider when it comes to your physical or mental health, because they really do go hand in hand, and we are here to support you through it all. Remember that each day is a fresh start, and today is a great day to have a great day. So I hope everyone stays safe and take care, everyone. So thank you all, and we look forward to hearing from you.